Hey guys, good afternoon. Dr. Andy Rosenfarb here with AccuVision Acupuncture. Today I want to talk to you about alcohol. All right, it's a big conversation that comes up with a lot of patients. So alcohol specifically as an inflammatory factor and how it could potentially accelerate progressive vision loss or acute vision loss for that matter. Now, very cultural norm for a lot of people to consume alcohol at events, celebrations. Some use it at the end of the day to unwind a little bit. And I don't have a huge problem with alcohol, but I want to explain to you what it does to the body so you can understand how it will affect your system and you can make your own decisions. Alcohol can be extremely inflammatory. It's arguably one of the most inflammatory substances that we know of. So a lot of you guys are dealing with pro-inflammatory conditions or pro-inflammatory ocular conditions, whether it's glaucoma, whether it's macular degeneration, whether it's retinitis pigmentosa, optic nerve atrophy, optic neuritis, a whole host of conditions. There's, for a lot of these eye conditions, these chronic eye conditions, it's very, very common that there's an inflammatory component. So also, especially if it's a neurovascular or an autoimmune, or even infectious like ocular Lyme or some of these other type of conditions like that. So alcohol being inflammatory will literally throw gas on the fire, okay? And what I mean by that is if you have a pre-existing condition, eye condition, or any condition, right? Cardiovascular disease, if you're dealing with joint pain, arthritis, this really goes for a lot of host of health conditions that involve inflammation. But of course, we're speaking specifically in trying to be relevant to ocular conditions. So, very important that you guys understand what it does to our body. So we already talked, and the first thing it does is it activates inflammatory processes, right? It really increases inflammation. How do we know that? Because those of us who've had episodes where we've had excessive alcohol consumption, what usually happens at the end of that episode? Headaches, dry mouth, eye pain, light sensitivity, right? Maybe even joint pain, sometimes nausea if it irritates your stomach. If it's too much and it really affects your liver, you can have alcohol poisoning. And of course, you'll be throwing up or getting the runs or something like that. So we know it's a strong irritant to the digestive system. We also know that it messes with your blood sugar because the alcohol has to process, the liver rather has to process the alcohol. And it has to work harder to break that down, metabolize it, and get it out of your body. So we're dealing with factors that, if you guys have watched my previous videos, and we talk about the top 3 factors that influence progressive vision loss, circulation, inflammation, oxidative stress, well, alcohol increases all 3. It reduces circulation. Little amounts, I'm going to take that back. So little amounts, it could be a vasodilator, right? Increase circulation. But in larger amounts, it actually has the opposite effect. It'll reduce blood flow. It'll also be pro-inflammatory, and it will also accelerate oxidative stress. So that's something else you guys need to know about. And what oxidative stress is accelerated aging. So long and short, guys, it is alcohol. Regular alcohol consumption or excessive alcohol consumption will, in fact, accelerate any condition that you have that's pro-inflammatory. We also know that alcohol is dehydrating, right? That's why you get headaches. That's why you have dry mouth afterwards. It's just dehydrates the body. That's what alcohol does. And we know that aging, part of the aging process, we have 2 big parts to aging, right? Dehydration. The body dehydrates as we age, and it also oxidizes as we age. So as you said, alcohol is going to accelerate oxidative stress, and it's also going to cause dehydration. So it's going to age you faster, for sure. So just know that it can accelerate these chronic conditions, and also it can be a factor in many acute eye conditions like eye strokes or retinal occlusions or ischemic episodes in the eyes and brain. It causes inflammation, puts so much stress in the vascular system that can actually cause something like an eye bleed or an eye hemorrhage, even if you have a pre-existing condition like wet macular degeneration, diabetic neuropathies, or retinopathy where you have active bleeding. You want to be really, really careful with alcohol for sure. Again, small amounts, we're going to talk about in a minute what's appropriate use. So that's the problem. The problem is that we have excessive alcohol use that can cause problems. So we want to limit use. And what does that look like? So limiting alcohol use is this. This is what you're going to do. Best is to eliminate alcohol if you can, especially guys, if you're over like 40, 50, like you really should be reducing your alcohol consumption. It's just not good for your health overall. That said, having like a glass of wine or even if you like beer sometimes or even like tequila, it's okay. Have like one drink periodically, maybe like 2 small drinks or something like that. But here's the thing, guys. First, make sure that you have food in your stomach. Don't drink on an empty stomach. Whether it's beer, wine, alcohol, whatever you're doing, don't have alcohol on an empty stomach. And it's preferred that when you do consume alcohol, you have it with fat and protein. Vegetables too. Carbs and sugar are probably one of the worst things you can have with alcohol because it basically accelerates the burning of those fuels and actually turns the sugars, it actually metabolizes sugars to make them more unstable, and that can cause some problems with dysglycemia and blood sugar. So having food in your stomach before you eat will actually absorb the alcohol and it'll mitigate the negative side effects, okay? The other thing you want to do is make sure, and again, when we eat, we want to make sure it's fat, something with good fats, protein, and also vegetables, because vegetables are usually water rich, and even fruits okay. But stay away from junk foods, like you don't want to have like a lot of cake, even though that's usually people have, a cordial or something like that. Second thing is make sure you hydrate well before drinking alcohol. Like you want to have 2 or 3 glasses of water, within an hour or so before you start drinking. And then you want to have at least 1 glass of water, if not 2, between your drinks. So if you're going to have like a glass of wine with dinner, have water before. You're going out to dinner, you're at an event or something like that. Have a glass of water, get some food in your system, have a drink if that's what you want. Then make sure you're consuming food. And after you finish that drink, cocktail, beer, wine, whatever, mixed drink, make sure you have more water after that, right? So you're going to have water before, have your drink after you've had some food and have some more water in that. The other thing you want to do is after you finish, if it's in the evening or whatever, afternoon, make sure you hydrate well before you go to bed. That's really important too. One of the other things I like to do is there are supplements that you can use that are pretty easy to help if you've been drinking. So let's say, okay, you had a fun night out, you're out with your friends, you're maybe on date night with your partner or something like that, or whatever, you just decided that you're going to have a couple of drinks. So look, whatever, eat, drink, and be merry when the time comes. And, in Chinese medicine, we even say everything in moderation, even moderation. So yeah, once in a while, have some fun, but just manage it. That's what this whole thing is about. Managing, knowing what it's doing to your body and managing the stress effects. So again, beforehand, we want to hydrate. We want to have food in our system. While we're drinking, we want to make sure we have food in our stomach and we're having more water. Afterwards, we want to continue with water, and we also want to take something that's going to help our body to detox. So there are a lot of teas, if you go to your health food store, that are liver detox teas. They have like milk thistle and a lot of different liver healthy herbs that will help the liver detox. So go to your health food store, get a liver detox tea or a detox tea or something like that. So that's something that's going to help. A lot of people have caffeine or coffee afterwards or the next morning. And that's actually it'll give you a little energy because of the caffeine, but it's actually one of the worst things you can do. Even green tea, because green tea and coffee will also be very dehydrating to the body. So we're already dehydrated from the alcohol. We want to hydrate, right? Not dehydrate. So we want to watch like more alcohol the next day or in the morning, not good. Coffee, not so good. Tea, herbal teas are good, like detox teas are great, but highly caffeinated teas like black teas, Earl Grey teas, green teas, probably not the best. Again, later in the day, maybe a little bit better. The other thing I want to talk to you guys about is what I'm a big fan of, these liquid IV packets. All right. They're not the best. There is sugar in them, but these are really good. I use them daily after I work out. But if I'm going to go out and have a couple drinks, like, you know, if I'm going to go out with some friends or my wife or something like that, like a couple weeks ago was our anniversary, like I'm having a pack of these before and after. It's a powder. You put it in a water bottle and you just kind of drink it down. So liquid IV is electrolyte minerals. And I get nothing. This is from the company. This is, find something similar or comparable. But basically you're looking for an electrolyte supplement, like a powder that you can put into your water and drink for the day after. And that's going to really help. All right. So the long and short is CBD actually is also very, very good for helping to mitigate, if you kind of drank too much alcohol. The last thing, if you have access, or there's two other things I want to mention. The other thing you could do that could be really, really helpful for detoxing after you've had, a night of too much drinking is hyperbaric oxygen. If you have access to hyperbaric oxygen, you can certainly use that, and that'll really open up your detox pathways. The last thing I want to mention as well is if you have the availability is after you're drinking, especially if you've had a big night drinking, after you kind of wake up and you're feeling a little hungover, try to find a clinic near you that offers IV nutrient therapy, right? So what they're going to do is IV is intravenous. So basically you're going to do something like a Myers cocktail, or something like that with electrolytes to kind of get your electrolytes going back in. So basically what they do is they set up a bag of fluids, put an IV in, and they will help rehydrate your body. That's really what it's doing. So those things will help. Again, we don't want you out drinking, partying too much, but we know that life comes up, and sometimes we have to eat, drink, and be merry, and just enjoy ourselves, but just not too much. So of course we want to moderate that. And especially, guys, if you have an active inflammatory situation going on and like you're prone to like migraines or headaches, or if you have active bleeding going on, or you're recently diagnosed with an eye condition, you're in the middle of treatment, really try to reduce your alcohol. And again, like I said, 1 or 2 drinks may help with blood flow and circulation. Certainly a glass of wine, with red meat or a higher protein diet is going to help with digestion. But we're talking a little bit more about regular habitual use of alcohol and or like binge drinking. Like if you're having like a lot of drinks, like more than 3, 4 plus drinks. But hydration is key. Reduce the inflammation and improve hydration. Use your electrolytes, consume food, a lot of water with electrolytes, hyperbaric therapy if you have accessibility to that, and then lastly, go get an IV therapy and sweat it out. If you have availability to a sauna or a steam room, not too long, just a little bit to start to get your detox pathways open, to get a little bit of sweating done. So Epsom salt bath may be useful for that too if you're really banged up. So that's my little bit on alcohol and how it could affect your vision. Again, in Chinese medicine, we always talk about that there's a direct correlation between the liver function and the eye health. So we really, it's been known for thousands and thousands of years about this correlation between alcohol and your vision. So we really want to make sure that you guys preserve your vision, stay healthy, and have fun at the same time. All right, guys. Take care. We'll see you next time. Have a great day. Dr. Andy Rosenfarb with AccuVision Acupuncture. Bye-bye.